If you are constantly experiencing pain in a certain area of your body, see what health conditions it may indicate. How often have you felt pain but never thought of the real problem behind it or its causes? We often tend to ignore some specific aches, explaining them away by saying that we probably just ate too much or we were sitting too much. In any case, we think of something to calm down ourselves. But there are specific zones in our bodies where any pains may be caused by different factors. Some types of pain signals heart issues, appendix problems, acute inflammations, allergies, and indigestion. Get acquainted with the most common aches and what they represent. Left arm ache, which goes from the chest and abdomen. The left hand is related to the heart. One should consult a doctor, as it's one of the primary signs of a heart attack. Welcome to Natural Health Plus. Before going forward, we request you to kindly subscribe to our channel so that you don't miss any of our videos. So let's start. Especially in combination with chest pain. Number 1. Chest pain. Depending on the type of pain, searing, crushing, etc., it can signal that there are issues with the lungs such as bronchitis, asthma, and allergies. In addition, it may be a sign of issues with gastroesophageal reflux, or a heart attack in case of dizziness, lightness, and inability to say anything, troubles with breathing, and sweat. Number 2. Middle spine and middle abdomen. The combination of a dull pain, vomiting, nausea, dizziness, weight loss, and heartburn may be signs of ulcers or gastritis. Number 3. Omphallous pain. Pain around the belly button may be a sign of constipation, gases, food allergies, indigestion issues, and issues with the small intestine. In addition, there may be problems with abnormal bacterial overgrowth, or signs of Crohn's disease, obstruction, or celiac disease. Number 4. Abdominal bottom right. This signals colonic diseases and troubles with the large intestine, diverticulitis, ulcers, and polyps, irritable bowel syndrome, especially when it appears in a combination with diarrhea, vomiting, or constipation. Number 5. Abdominal upper left. In combination with nausea, vomiting, and fever, it may sign the trouble with the pancreas. Number 6. Bottom back pain. This may be a sign of kidney disease, if accompanied by fever, vomiting, and painful urination. Number 7. Abdominal upper right. This ache is a sign of liver and gallbladder issues. If you have shown signs of yellow skin, vomiting, nausea, and low blood pressure, it is advised that you consult a doctor. If you liked the video, give it a thumbs up, and please share this with your friends and family. And let us know what you think in the comments section below. For more recipes and tips, subscribe to the channel. Thanks for watching. Before leaving us, kindly check out our these cool videos. Goodbye.